Welcome to the Bettis Musgrove Show, the podcast where personal injury legal expertise meets real-world advice to empower and protect you. Join us as we delve into the critical aspects of personal injury cases, break down legal jargon into actionable insights, and share essential safety tips to help you navigate life's unexpected moments. And now, here are your hosts, Spencer Bettis and Ben Musgrove.
Well, welcome to episode 8 of the Bettis Musgrove Show. As always, I'm Ben Musgrove. This is my law partner, Spencer Bettis. We own and operate a boutique law firm in Cumming, Georgia, specializing in personal injury. We come to you every couple of weeks with this podcast just to talk a little bit about what we do for a living in personal injury and advise people as to what they should and shouldn't do, and hopefully give some tips and help them in the event they are in some sort of personally injury-related event. Today, we are joined by a special guest in Dr. Kyrstin Jimenez. Dr. Jimenez is a counselor, and she specializes in trauma. So, Dr. Jimenez, thank you for joining us.
Thank you for having me.
And we just learned that you are affectionately known as Dr. J, so we may just call you Dr. J from here on out.
That sounds great.
All right, fantastic. Well, again, thanks for joining us. We thought we'd start out by just giving you an opportunity to sort of tell us about you, where you came from, how you got here, and where you are now.
Sure, yeah. So I have my dad who was in the Army, and so I was born in Oklahoma, and then we moved to Fort Benning when it was Fort Benning, now Fort Moore, and then we stayed there. So I grew up in Columbus, Georgia, and then I went to Berry College, and I majored in psychology and minored in women's studies, and then I actually went back to work at his office for a while, and then I went to grad school at Georgia State, got my master's in rehab counseling, and then I continued there for my EDS, and then I moved out to Texas to UNT to get my doctorate. Okay,
so first let's talk about Muskogee County. You know we love Muskogee County.
I do.
How'd you like growing up there?
It's well documented. I tolerated it.
Okay.
It wasn't for me, I think, but I know a lot of people still love it. I know my brothers, 2 of them still live there.
Yeah.
I think it's developed so much around the Riverwalk. I think now I would love to live there.
Have you been back to do the whitewater rafting thing?
I haven't gotten a chance to do that yet. I have wanted every time to go do that.
That is fun. I highly recommend you go do that.
Yeah.
So then you go from Columbus up to Rome, Berry College. How'd you like Rome?
I loved it.
Yeah.
I loved
a good place.
Yeah, it's beautiful. The campus is gorgeous. And also, I think it was a time in life, just growing up and having more freedom and getting to do dumb things with your friends and all that. It was very fun.
So from kind of big town to small town and then downtown Atlanta to Georgia State.
Yeah.
Was that a big transition?
That was a culture shock. Learning how to even drive in traffic. I was like, why, I never.
30 minutes to go to the store 2 miles down the street.
Right. Unheard of.
Absolutely. Well, tell us, how did you get into counseling and what do you like about it?
Yeah, I got into counseling because there's some family issues there, right? There are people in my family who suffered from using drugs and alcohol and things like that. And then also I have a family member who has had severe mental health issues. And that's really what pulled me to it, is because I ended up experiencing a counselor when I was young, and they didn't do anything for me.
Yep.
It was really bad experiences. And I'm the kind of person who's like, well, I can do that and I can do it better.
Right.
And I just thought, if there are all these other kids that have had experiences that were so disheartening and so discouraging, then I think I need to do better.
Right.
I have no choice.
And there are plenty out there who are very disheartened.
Mm-hmm. Absolutely.
A question that I know a lot of people have, I know it because my wife is a psychiatrist recruiter, but what is the difference between a psychiatrist and a counselor?
Great question. I get this a lot, too, in my office when people accidentally call me a psychologist or a psychiatrist.
Right.
So a psychiatrist prescribes medication.
Okay.
And they can be very helpful in a lot of instances, but I do not like to push medication on people. I like to try to do everything we can do. So a counselor is someone who will process emotions, events, feelings, thoughts, and all that kind of stuff, and help somebody kind of go back inside themselves to see what coping skills they can grow and develop, because they're already usually there. We just want to work through and kind of like weeding a garden, right? You want to make sure that you pull out the bad stuff, the stuff that I would say is not serving them, and then put in some more, maybe some fertilizer. Maybe they need some more water or sunlight or those kinds of things.
Okay. Well, and we talked about that and we'll get into it more, but you specialize in trauma counseling. Mm-hmm. So from a personal injury standpoint or trauma standpoint, is there any advantage to seeing a counselor versus, say, a psychiatrist?
I would say so. So a psychiatrist is simply going to prescribe medication.
Yeah.
And a lot of times the problems that people have after personal injury, medication is not indicated to help solve those problems, because medication isn't going to help you drive again when you're fearful to drive, or help you work through the PTSD that comes from feeling like you're going to get hit from behind every time you stop your vehicle, or you can't trust anybody, right? Because that's the crux of the trauma experience, is that my worldview has changed now. The world is no longer safe in ways that I thought it was. Yeah. And a counselor will help you to figure out, because I'm not there to say, yes, it is safe, because the reality is it is not safe. And now you've experienced it, and now you're living that experience of the world no longer being safe. So how do we help you to have realistic goals and ideas around what comes next, right?
Yeah.
How do you drive again knowing that you could get rear-ended again, or you could get T-boned again, right?
Right.
We're not there to say, how do you learn to drive again like you're in a bubble, because it's not real.
Well, you pretty much just covered everything that I want to talk about in the podcast, so I may have gotten a little ahead of myself, but diving into you a little bit more, looking back on your career, Columbus from Atlanta over to Texas, like thinking back on everything that you've accomplished, is there anything that's sort of a most pivotal moment or any milestones that you've crossed that have led you to where you are today and what you do?
There are a lot. I'll try to pick just a couple. One, my time at Berry College was very informative of my life in general. I learned a lot of good morals and values and things like that there, and learned how to grow into a woman I am proud to be. Still could use some more refining and growing, but I think that that's part of the human experience. While I was there, I interned at a psych hospital, and I also worked in a domestic violence shelter. And those were pivotal in my career to see even further still how people are underserved in mental health.
Sure.
And then I also, after I graduated from Berry, I ended up working at my father's. He's a medical doctor, I think I said. And so he had an urgent care in Columbus. And I worked there for a couple of years. And that also helped me grow the depth and breadth of my medical knowledge. And so me working in personal injury now is kind of a marriage of the mental health side of things and the medical aspect, and understanding how medical injuries or disabilities or illnesses can really impact people's mental health.
Yeah, completely off topic. I wasn't thinking about it, but following the pandemic, have you seen an uptick in people needing counseling?
Absolutely, yes. And I've seen an uptick in what's acceptable in counseling, right? Meaning, when do people reach out? They don't wait as long a lot of times. That's how I ended up in crisis and trauma, is because when I did my internship at a place called SETPA in Norcross, that's what I started noticing, is we weren't set up to be a crisis and trauma clinic, but people waited until their symptoms were so severe that that's all we had to deal with. That's all that was left for us. If someone comes in with more mild symptoms, we can mitigate how bad it gets a lot of times.
Yeah. You mentioned a big part of your practice is trauma counseling. How does that interact with like personal injury clients and patients? And that, how does that kind of enact in your practice?
Right. So one thing we do, and very conscientiously, is we offer telehealth services so that we can see people from their own homes or from their offices or from wherever they are. Because it doesn't really make any sense for me to say, hey, you're terrified of driving, why don't you drive up to my office?
Sure.
Right? And then you're all wigged out and you're not feeling stable and grounded and stuff. And then we spend the whole session doing that and then ground you, and then you get back in your car, like shaking your way home. So that's one thing that I try to take into consideration a lot, is like, what is best for the client, and can we meet their need in the modality that we're using? Another thing that we do is really take our time with clients, and we don't rush through things. We try to have a thorough evaluation, because we're also working with maybe some undiagnosed conditions before they ever had an accident.
Yeah.
And sometimes, unfortunately, the accident isn't the worst thing that's happened to somebody, right? So a lot of times we have to take our time to uncover that people were in abusive marriages, or they've had sexual trauma, and things like that. And also the car accident has made their symptoms exacerbated.
Sure.
So we have to be really careful and cautious, and that's part of being trauma informed, to kind of go back more towards personal injury and how those things come together. But it's really important to be trauma informed as a counselor working with anybody in personal injury.
Yeah.
Because they are still human in totality, even if all they have is some anxiety after an accident.
Right.
Yeah. What are some common symptoms you'll see from personal injury clients?
Anxiety, a lot of anxiety. And so that might come across as calling y'all's offices 24/7, right? Like, what's going on? What's going on with my case? And my back hurts. And a lot of that anxiety piece, and they have no one to really talk to about it, because they're going to chiro, they're going to PT, they're going to ortho. They have all these, usually when it's not their fault, especially, it becomes really difficult for them because it's increasing their life stress in general. Their financial burden becomes greater because they have to take off work. Right. And they're suffering in those ways. Sometimes it's hard to drive to work. I've worked with lots of clients that's the first thing we start working on, is how do you at least just drive yourself to work? And let's work on everything else after that.
Well, and personal injury is a big box. I mean, there are a lot of things that fall within personal injury. So in general, when you're looking at somebody who was in a car wreck versus maybe somebody who was in a dog bite incident, I would imagine that their symptoms are different. Is that fair?
Yeah, I mean, you could say that. Some of the symptoms do definitely overlap, and that's what I have to listen for, is like, what am I hearing? I'm hearing hypervigilance, like hearing every noise and moving around and not sleeping. That's another really common symptom, is just their sleep is so disrupted. Sometimes the eating is disrupted.
Is it insomnia, or is it nightmares, or both?
It can be both. When it's nightmares, a lot of times we're looking for PTSD there, right? Usually there aren't a lot of nightmares when it's simply more anxiety or depression.
Yeah.
But a lot of people can go to those extremes of from just PTSD to also feeling suicidal.
Yeah.
We see with a lot of clients, a lot of times they're very anxious to drive accidents. Is that something that you see a lot?
Yes, we do see that a lot.
Well, you were talking about this too, so having people, you do the televisits, which are awesome. In our practice, I love meeting our clients. At least the first meeting, I want to sit down with them face to face and just get to know the person. But since COVID and the pandemic, most everybody wants to do everything online, by email, Zoom, whatever the case may be. So a lot of that personal interaction is kind of fallen off. I hope it comes back. And I try to still make it a point to go, at least when we're giving a settlement check or something like that, I try to meet them in person. But do you see a difference, or do you think it's important to have any in-person visits as well as the televisits, or are you comfortable just doing televisits?
I'm comfortable doing just televisits. My preference still is if I could sit across from someone and we can feel each other's energy, then a lot of times they will feel more comfortable with me to tell me more sooner if we're face to face. But it can also work the opposite way on telehealth, because there's more like anonymity for them. So they might open up a little bit more that way. There are definitely people that I have worked with that I've had to say, this is just not going to work for us for lots of different reasons. Usually it's technology related.
Yeah.
Right? Where it's like you're just not able to handle this level of technology, or they just can't support the bandwidth with the internet.
My biggest pet peeve is when we do a deposition and we do it through Zoom or whatever the case may be, and the deponent picks up their cell phone and they're doing the Zoom meeting on cell phone. I'm like, no, you're going to lose service. Like, you're probably driving and you shouldn't be driving and doing this at the same time. Put down the cell phone. Just let's go back to doing this in person. This is terrible.
Yes.
Yeah. So that's a big component, I guess. Knowing that people can come see you and talk to you, though, without having to face that fear of driving initially after an accident. That's awesome.
It's a good point for our practice, too. A lot of times it will drive the client on the first meeting, but something for us to keep in mind is maybe we need to do that a lot if they have some anxiety about driving.
Yeah. And we've got a client that we're working with right now, actually. He was a FedEx truck driver, and he got in a car wreck when he was just driving his own personal vehicle. Another actual box truck came across an intersection and hit him and messed him up really bad. But he got back to pretty good health, and his doctor cleared him to go back to work, and he started driving this tractor trailer again. And he eventually quit his job. Excuse me. Because he said he felt unsafe driving the tractor trailer, which I think is honorable. I mean, most of our clients would probably just stop driving and hope that they get a nice settlement check, and that's going to be good enough to push them forward. This guy stops driving. Instead, he goes to work for a different company doing something completely unrelated to driving. But his anxiety completely altered his life, changed his retirement. So, I mean, I understand exactly where you're coming from when you talk about that anxiety.
Mm-hmm, absolutely. And sometimes if I'm just thinking of myself working with someone like that, I can't promise that that person would continue to work for UPS and everything. But what I could say is that I would be able to help them make their decisions intentionally and not fear-based, right? It would be like, this is something that I really want to get out of versus I'm just so scared to drive.
Right.
I'm just too scared and I'm just not going to do it.
Yep. And he kind of went a different route. He went to counseling through his pastor and some people at his church instead of seeing a professional. But at least he was talking about it. And I think that's really important.
That's very important.
Yeah. In your opinion, so like we talked about, personal injury is a huge box and trauma itself is a big box. I mean, there's a bunch of different areas where people fall in there. Does everybody suffer some sort of, I don't want to call it mental instability, but some sort of mental issue following a traumatic event?
If it's by nature traumatic, then yes.
Okay.
Like that by its very nature would impact people.
So even your toughest logger man who's just the strongest guy you've ever seen, he gets in a traumatic event, chances are he's probably suffering in some capacity, whether he's talking about it or not.
Mm-hmm. I would say so. The difference is really like what severity level are we looking at? Because it can go from this will be bothersome to me for a few days or weeks to this is now developed into PTSD.
Yeah.
So this can be bothersome just for a short amount of time, and it doesn't negate the fact that the event itself was traumatic.
Right.
What makes it PTSD versus just someone who's experienced trauma is that the person may not have the same level of coping skills or what we would call mitigating factors to lessen the impact of that traumatic event.
That makes sense.
Yeah, I think it'd be good to talk about PTSD since you mentioned it. We hear about it a lot in the military context, and I've been in the military. I've known folks that suffered PTSD, maybe for other reasons, but is PTSD pretty common in personal injury events, whether it may be a dog bite or an accident? It's pretty common occurrence?
From what I see, it is pretty common, especially because, again, people are sometimes waiting to get the referral to me until the symptoms are pretty intense and severe to where other attorneys can even notice this is probably PTSD. We need to get this person some help.
Yeah.
So one thing that would be great is if the referral comes a little sooner before it turns into that.
Yeah. So how long should someone wait, if at all, to see you after a traumatic event?
I would suggest the sooner the better.
Yeah.
I know it's hard to put a timeline on things like that, but I would say within the first month would probably be best. 2 weeks is even better than that, because everybody after an accident pretty much is going to suffer in some kind of way. Even what I mean by that is even just increased levels of stress as they're trying to navigate. And a lot of people don't know what to expect, like how the system works, how long this may take, how many appointments you might end up going to, how many specialists you might end up seeing. And so sometimes even just the unknown factors can create a lot of anxiety for people. Or when am I going to get a check for my car? My car is totaled and things like that. And that is something that, because we work in this space, we know about.
Sure.
And we don't make promises, right? We don't know everything, but we can give some of that information. And I consider us a resource for people like that as well, just to help kind of handhold through that process. Because a lot of times attorneys don't have time.
Yeah. Well, and you touched on something there too that I get probably daily, is how long is this going to take? I mean, when it comes to healing from a traumatic event, I imagine you can't put a timeline on it, but do you have goals? Do you want to be at a certain spot after a couple months or a year or whatever the case may be?
Absolutely. I would like, my goal in my clinic is to have the most efficient therapy possible. Okay. We kind of consider ourselves emotional surgeons, right? Yeah. I want to be able to get in, fix what we need to do, help build coping skills and things like that, and resources and social support networks for these clients. And then I want to get out. I don't want to see somebody for 2 years, unless it's very necessary. So I would say most of the clients we end up working with, we see them for about 6 months tops.
Talking about coping skills, can you give some examples of what a coping skill might be?
Yes,
Okay.
I can.
Excellent.
Great question. So one coping skill is simply just intentional deep breathing. Like learning how to control someone's breath and breathing is super important because it also has physiological wonderful benefits of being able to bring more oxygen to the brain so we can think more clearly. We can calm down more. It'll help clear out some of the cortisol, which is our stress hormone, and we want that to dissipate a bit. So that's one coping skill. Another is a lot of times we ask people about their faith, their spiritual lives. And if they want a spiritual life or they already have one, like how do we keep you involved in that? How do we get you involved in that in your community and what you're interested in and what your beliefs are? Because that's a great source of social support for a lot of people. Some people I work with also are no longer able to see their friends the way they used to, right? Because they can't drive or because they are inundated with all these new appointments. And we also have to remember that we don't necessarily know what their lives were like before. So, for example, I've worked with someone who is caregiving to both her dying parents, and that's already on her plate. And now she has all her own appointments to go to, and she needs to speak to their attorneys about building a trust for them and putting all these documents in place for their end days. And she still has to go to the chiropractor, and she still has to sit and talk to me, and she has to do all this other stuff.
Yeah, and then just be a person.
Yes. Right. And we've been working on coming to terms with maybe you're not going to be there when they take their last breaths because they also live a few hours away. Right. So if you're caught up in something here in Atlanta, what is that going to look like? How fast could you realistically go? And are you going to have your phone on you? Because you can't during an MRI. Just things like that are really increasing the amount of stress for people that even if they don't develop PTSD, it's still really important for them to have additional support emotionally. Like I said, especially when their lives outside were already pretty heavy or chaotic. So coping skills, going back to that, what we work on together is those things. Like, how do we build your social support a bit more? Because you need that. How do we make sure that someone could get in touch with you if you are at an appointment and you can't have your phone on you? How do we do this, that, and the other? Like, we're here to problem solve, not problem make.
Yeah, scheduling, whatever the case may be. I want to go back to the breathing for a minute. So I swim a lot. And I have a coach, which probably shouldn't admit that I'm a grown man with a swim coach. But he has me working on breathing a ton, and I notice that when I'm doing my breathing exercises, I just completely feel at ease when I'm done with it. So when you're helping somebody with breathing, are you doing like a breathe in for 10 seconds, hold it for 10 seconds, breathe out for 10 seconds type thing, or is it?
It's something like that.
Yeah.
Usually the breath in is pretty short, like 3 seconds, and then hold the breath for about 12 seconds if you can, and then exhale for 6.
Okay.
So
repeat a couple of times.
3, 12, and 6. You can write it down and practice it and see how you feel after.
Yeah.
Normally I like to do that in like 6 rounds of that with somebody, and you'll just see their whole body, their stress levels just decrease tremendously.
Sometimes I push mine up and try to hold it for a minute and a half, and then I start freaking out a little bit. But when I do the shorter
that level.
That's good stuff.
You mentioned some already, but what's some other tools that maybe if someone's not seeking treatment after an accident that they could do on their own to cope?
If someone's not seeking treatment, but they want to have some skill on their own.
Yeah. Or what shouldn't they do as well?
Oh, sorry. Yeah, the do's and don'ts, right?
Yeah.
Okay.
Well, just what can they do? Yeah, and what shouldn't they do?
Okay, one thing is talk about it. I think it's important to talk about it with your friends and family and people who understand you. And we run into this sometimes too, though, is that other people diminish or dismiss the story of like, it was just an accident. Why are you acting like this? Or, just wanting people to really just talk to someone who's not a professional. Sure. But I would say the do's are talking about it with people you trust and who will validate your experiences and will be supportive of you. Ask for help when you need it, right? Like, I know I've been in a wreck recently and it's hard for me to pick up my son. So a lot of times I'm like, oh, you can stand on this chair. So I'm trying to find creative ways that I can get you on the level you want to be at, but I am not going to continue to injure myself.
Yeah.
Right. So another thing to do is follow doctor's orders, because once the pain goes away, a lot of times other areas of stress can decrease for clients. Yep. A don't is don't drink and don't do drugs to try to numb the pain. Okay. Those are not good ideas because those have a whole other ton of mental health implications that are usually very negative for people. And some people want to do that. They're like, I just got to get out of this pain. And they end up not intending to drink as much as they end up drinking or taking more medicine than they should. But that's where it's important to talk about it. And that's one of the things I do is try to thoroughly talk to people about what's going on and what's really happening.
Yeah.
But they shouldn't do that with a professional, and they shouldn't do that on their own. Right?
Yeah, absolutely. And I imagine exercise, if they're able and not too much pain, exercise could be good.
Yes. I always refer and defer to the doctors, the medical doctors on that stuff. Is like, if your doctor said that's okay, that's something that I would definitely recommend is take a walk around the block.
Yep.
Maybe not at 4 p.m. when it's hotter than Hades outside, but, but truly consider taking those things into consideration of how old they are too, because I wouldn't recommend a walk late in the evening for someone who's older. Things like that, though, like what time? Then that's how we make goals together. Is like, what time? When are we going to do this? What's achievable, right? What's realistic, and all of that kind of stuff.
Yeah, I had back surgery, I guess 4 years ago this month, actually. And I didn't do much physical therapy. They just wanted me to walk a lot. And I go crazy if I'm not doing something. I can't just sit there. Like, I hate going to the beach and just sitting in the sand. It's awful. But so after the surgery, like a week later, I'm up trying to walk with my little cane going down the street. But it made me feel a lot better. I wasn't just sitting there wallowing in myself, pity in my recliner, watching daytime television. So
right, those four walls can start becoming a prison cell.
Yeah.
Right. We forget that the whole world is so much bigger than us if we don't get out there.
So do you work with kids, adolescents, adults, the whole 9 yards?
Yes, sir.
All right. Let's talk about that for a minute. So after somebody's in an accident, whatever it may be, do the 3 different age groups respond differently to the trauma?
Yes, and genders.
Okay.
So with men, you'll see more anger, more frustration and expressed that way in anger. And for women, sometimes you'll see more tearfulness. Yep. And for children, you'll see it in their behavior. So children won't necessarily use their words. And adolescents, they're not as good with using words. They don't have the cognitive development to be able to name their experiences a lot of times. So they'll show you, like, by refusing to get back in the car, right? They're going to make it known that they're not going to do that. And sometimes it comes out in behaviors at school as well, where they were not misbehaving before, now they are. So those kinds of things are really important to look for. And then men specifically, to try to get them to talk about it. That's really important. And sometimes that's difficult because men often lack the emotional vocabulary to express.
Guilty.
Right?
Aren't we all?
So that is part of what we do too, is to help label emotions and feelings and the experience itself. Yeah. Like, and normalize it. Like, sure. It is normal. Even if you are the toughest, strongest man in the world and you're a lumberjack and all those other things, like, you had maybe a near-death experience. Yeah. So is that weakness to have been impacted by that? Right. Or is that human?
I'm glad you said lumberjack. I said logger earlier. Lumberjack's a much better way to, Should remember that. And we do, especially with kids. I mean, I told you earlier, we have a client right now. We actually just settled it, but they were in a bad wreck on the interstate in a Jeep, and the car rolled 4 or 5 times. The toddler was in the backseat in the car seat, and miraculously, not a scratch on his body. But his mom will tell you now, trying to get him into a car seat to just go to Chick-fil-A and get ice cream, like, he just will not get into the car. And they said it takes them an hour to get him strapped in, and they have to hold him down sometimes and make him get in the car. Because, I mean, the reality is you've got to go places. You can't leave him at home all the time, but he's struggling. And I think he's 3 years old, so you see that often.
I do with children that age specifically, and we do play therapy with them. And I had a case a few months ago where I was working with a little one who was also scared to get in the car seat. And I ended up doing a session with them and then brought them to the parking lot. I was watching first, to be honest, like a little spy. But I was watching mom try to put her back in the car seat, and I was just going to see how it played out. And then when they were out there for like 15 minutes, I was like, okay, I'm going to go head in there and see what I can do. And the child ended up crawling into my arms and nuzzling into my neck, and then just comforted her for a little bit and talked her through it and put some encouraging words out there, like, you are so brave. You got all the way here from your house and just all those kinds of things. And then she ended up getting back in her car seat with no issues.
That's awesome. I may have these people call you because little man's not compliant.
Not into it, yeah.
What about adolescents? So you said they often struggle sort of expressing how they're feeling. They may act out instead. Mm-hmm. Is it more of a physical acting out, or is there just a shutting down and not wanting to come out of the room, or what does an adolescent typically do?
Great question again. So adolescents, I would be most concerned with some isolation, especially from friends, right? And I've said this before, but I'll say it again. Adolescents, it's not normal to hate your family.
Right.
So if someone is starting to avoid coming downstairs or out of their room and that kind of stuff, that's troublesome, right? That would mean something to me, and I'd want to figure out what's going on there. Also, if you see any adolescent, this is more extreme, but wearing long sleeves in the summertime and stuff, like it would be a good idea to check out their arms, see if they're cutting themselves and things like that. But the social isolation would be a big ticket item for me. Is like, that's a big red flag. If someone is no longer hanging out with their friends, even if they're a gamer, but they're not gaming as much. Like if there is a change in behavior for really children, adolescents, or adults, that's really important, and it could be an indicator of a mental health issue.
Yeah.
Let's think about something, we as attorneys are often interacting with folks that have been through something traumatic. What's something that we as the attorney can do to be helpful?
Good question.
Yeah, listen. When your client calls and they're really upset and they're crying, or you hear them, feeling angry, listen. And then make a referral if you feel it's appropriate. They really need a professional to talk to about this. I can't, this one conversation won't really change their lives. I think that's probably the biggest thing, is listen to what the need is, and how long you think they need to talk about it. Because if it's more than, 15, 20 minutes with you, that might kind of cue you in that they might need to talk to somebody professional.
Yeah. And a lot of personal injury lawyers will probably shoot me for saying this, but I'm a big fan of our clients journaling what they're dealing with. And really because it may be 2 years before we get to a jury. Or maybe even longer than that. I've had some that went 6, so that's a long time to try to remember what you were feeling at the time of the trauma. Does writing it down, do you recommend people write things down, and how much detail should they go in, that type of thing?
I think the first thing I would say about journaling is that it needs to be in a safe space. So if there's any family domestic violence or anything, or a concern that someone would read someone's diary, not to do that, or their journal. But otherwise, I think it's really great. I think it's wonderful. It's a great therapeutic tool we recommend often as well. And that is real. There's a thing called therapeutic amnesia, where by the end of the sessions and someone's feeling great, they're like, it was never even that bad. I don't know what I was worried about. Right? And that's my job, to be like, that is not accurate. I remember our first sessions.
Absolutely. And I want to talk about this a minute ago with coping mechanisms. So I used to be terrified of airplanes, and still to this today, I don't love them. The physics doesn't make sense to me that this thing can fly. But I had an absolute panic attack one time shortly after we had our first kid on an airplane, and turned the color of this piece of paper here. I mean, I was white as a ghost. The pilot came out and was like, "Hey man, you okay?" And I was like, "No, I'm not. This isn't going well." And so he took me aside, talked to me about the plane and how safe it was. But I made myself go research planes, and I watched a ton of YouTube videos on planes and what they can do and all the backups, and basically educated myself on airplanes. And now, like I said, I don't love it, but I can get on an airplane and make it through a flight. Just went to Spain a couple of months ago. 10 hours. It was awful. I was miserable for 10 hours, but we did it.
I'm imagining the stress sweat.
Oh, that's terrible. Yeah. Is that a good idea? I mean, is there a way for people to educate themselves? Are there any resources to go read up on hey, you're going through X, Y, and Z related to this trauma? Can they do that and improve their position?
That's a great question. Immediately off the top of my head, I'm not aware of any resource specific to personal injury type stuff. I think one of the best ways for someone to educate themselves is to talk to their counselor and get resources, because it all depends also on their own individual needs. And if they're scared of cars, they could research cars.
Sure.
I couldn't guarantee that they won't feel just as scared or not worse by reading that kind of information. to be honest with you, right?
I mean, I guess luckily planes don't crash often, but cars wreck all the time.
All the time.
I had a wreck this morning on the way into work. So, yeah.
Right? So I don't know if that would necessarily help in this specific situation, but the recovery stuff, if they read about how people survive and get through PTSD, that would be great information for them to have. I highly recommend that.
Yeah.
There are also lots of videos on guided meditations and things like that if someone can't afford counseling for some reason or just couldn't make their session, they can look those things up. And those are things we utilize and advise our clients to do as well outside of session. It's like, go do those things. And then together, that's part of what I do a lot, is talk about guided meditations with clients and make it individualized for their own needs and desires.
Yep. So follow up on that, and disclaimer, they may call us counselors at law, but I'm not a counselor. It's like you hear people talk about somebody has a fear of snakes. Well, then just go put yourself around snakes and pet snakes and hold snakes, and maybe you'll get over it. Is that kind of sort of tough love a decent idea? If you're scared of driving in, should you just make yourself go drive, start slow out on the country road and work up to Atlanta traffic? Or
I say no.
Okay.
Because you need someone there to help keep you emotionally safe while you try to do those things. And I have seen people and talked through multiple times on how they show me how you look when you're driving. Right. Like, does that make you a safe driver? You're white knuckling it. Yeah. Like, how are you supposed to possibly react? Right. You can't, right? You have to. I'm like, so we need to figure out what can we do to help you before you get in your vehicle, to have your shoulders down, to feel your stress levels lower, to before you turn on your car, you need to be calm. Yeah. That's a very dangerous driver like that, right?
Yeah, breathe, say a prayer, whatever the case may be.
Mm-hmm. All of it.
Ease into it. Yes. Put your phone up.
Yep.
You got anything else, Betts?
Yeah. Something I know clients typically have a concern about is cost. When someone's seeking treatment, is that something that can be covered by insurance, or how is that typically handled? And then how is it handled in the context of a personal injury claim?
Yeah, so usually with personal injury, it is a lot of times it's not covered. When they find out, insurance finds out it's an MVA. However, that doesn't mean that's always the case. And every counselor is different. So just like doctors, we each have to be paneled with certain insurances for them to accept it. My clinic specifically does not accept insurance for these reasons. I was ending up paying someone about the same or more money to chase my money from insurance than I was. Right? So we don't do that.
We chase insurance every day.
Yeah. Right? So it would depend on each individual counselor, how much they charge and those kinds of things, which also we work on a lien. So with personal injury, you don't have to pay for your ortho and you wouldn't have to pay me directly. It would come from the settlement.
Yeah, and that's a big deal for a lot of people who are uninsured, especially in our line of work. I mean, we deal with liens a lot where the doctor says, yeah, hey, we'll treat them. You guys guarantee us we're going to get paid when they get paid. Most of the time we're able to work something out and everybody gets something, so nobody's left holding the bag. But sometimes, you may not have the result you want to have, and the doctor or counselor in this case may not get paid. Have you ever seen that?
For sure.
Okay.
Hated it.
Yeah. But at the end of the day, they're all better, I guess, and feeling better about themselves.
And I do love that aspect of it. But a lot of times, too, we work with the financing company. Yeah. So we do get paid because I can't keep staff if I can't pay them.
Sure.
Right. So I have to in order to have the highest quality clinicians that I can have, then I need to be able to pay them. Right. So we work with financing.
It's just a reality of what we do. I mean, we say it all the time. Like, we want to make sure that they have a successful result. We're not going to retire off of their case. It's all about the client or the patient in your case. But the reality is we've got to get paid, or we can't have this office to make sure people.
That's absolutely the truth. Yeah. Yeah. Awesome. This is how we feed our families.
One thing I wanted to follow up on earlier, and I completely forgot, so we're going out of order, but are you aware of any sort of genetic components or any predispositions that might subject someone to more adverse results after an accident?
Besides medical stuff, of course, you're speaking of personal injury and counseling, right?
Yeah, or just in general, either way. Like,
I think not genetic dispositions necessarily, but I would definitely say that the fewer, and we know this from our research and literature, is the fewer social support someone has in their lives, then the more likely they are to develop mental health issues.
Okay. And then along those lines, so if somebody, let's say 5 years ago, they had a bad car wreck, took them a minute to get over it, they're finally better, today they get in another car wreck, are they more likely to suffer greater than they did the first time, or is there any science behind that?
I would say it would probably depend on the amount of suffering they had first, because if after the first one, you said they were good after 5 minutes?
At 5 years.
5 years.
Yeah.
Then what we do know is, like, if someone does develop PTSD or does develop depression, like clinical depression, not just like I feel sad, or anxiety, we become predisposed to having those diagnoses again and experiencing those kinds of symptoms again.
Yeah, that makes sense. What else you got?
Well, we can do our quick fire questions.
Let's do something fun.
Yeah, line it up a little bit.
Finally.
Yeah. So the first one is my personal favorite: Starbucks or Dunkin'?
Starbucks.
Me too.
Oh. We're going to have to cut that.
Yeah.
Oh, wait. Are y'all sponsored?
Not yet. But Duncan, I'm here.
What's the last book you read?
I had to write it down. The Tears That Taught Me by Morgan Richard Olivier.
Tell us about it.
It is like kind of a collection of poems about just tough stuff that can happen in life and how to mitigate those things. Like you can't just tell somebody to get over it. That doesn't work, because they would have had done that already.
She reads real stuff.
Yeah, it seems relevant. Last meal, what are you having and from where?
Okay, since this is kind of a fantasy question anyway, I would have my mother's lasagna, and I would probably have it on my parents' back porch when I was growing up. I loved sitting out there.
Okay. Credit to Corey Phillips for that question. He asked me that at dinner one time, and we talked forever. So that's going to be a staple here in our questions.
I love it. It's a great question.
Follow up on that then. So you get to have dinner with any historical figure ever in the history of the world. Who are you going to go with?
I don't really have a good reason, but I would pick Henry David Thoreau.
Okay. Didn't see that coming. Yeah.
I really was inspired by his moral convictions, and like, no, I'm out of here. I'm going to live in the woods and see y'all later.
You think it's going to be a fun dinner or kind of melancholy?
I think it's going to be melancholy, but I'll still try to make some jokes.
Okay. I like it. What do you do at the end of the day to sort of relieve your own stress?
What I really do, or what I try to do?
Both.
Because what I really do sometimes is just keep going till I hit the bed and pass out.
I can relate.
Yep. So what I really try to do is do some of the deep breathing, and I ideally would put my phone away and stop playing on that till I passed out too. That'd be a good idea. It is, right? But scents are also really important to me. So I do usually have a candle warmer, and I turn that on so that the room smells really aromatic and nice when I fall asleep.
Nice lavender or something to help you sleep easy?
Yes.
Okay.
Yeah.
We have a candle warmer in our room. My wife's paranoid that it's going to catch the house on fire, so we turn it off before we go to bed. But yeah,
I live in La Vida Loca over here.
Favorite vacation spot?
Oh, Luna Wana in Peru.
All right.
I live there. It's like on a river. It's gorgeous.
Not Columbus, Georgia.
It's close second.
What's the best concert you've ever been to?
Oh, that's a great one. Red Hot Chili Peppers.
Oh.
I like that.
Okay.
It's really fun.
What's a skill or hobby you picked up recently?
It's kind of recent. I was starting to learn how to crochet and knit.
All right.
Yeah.
I'm seeing a trend here. Mr. Thoreau, crocheting and knitting.
Oh, no.
Yeah,
I'm outing myself.
What's one item you can't live without?
To stay on trend, my reading glasses.
Okay.
I'm just kidding. My water bottle. I really like it. And it makes me happy.
Let's see it.
Look how
Stanley,
cute it
what are we
is.
okay.
It's a
Corksicle?
Yeah.
Okay.
I really like it because it's so bright and lively, and it looks like some kind of sorbet.
You could use it as a weapon if you need to.
If I have to, I will. Yeah. So watch out.
All right, last one. Do you have a favorite quote, mantra, something like that you live by?
One that comes to mind is don't add fuel to the fire.
Okay.
So when there's already a problem and a fire burning, like, I'm not trying to make it worse. Okay. I'm trying to maybe make it better, or at least not make it worse. So that's what I would say about that.
Awesome. Well, we'll close it up. Is there any last bit of advice or anything you want to offer anybody who might be struggling with trauma or just any sort of mental issues?
Absolutely. If you can get treatment, get it. There are lots of free clinics or low-cost clinics in communities all throughout the United States. And if you needed some help, there's one place to look that I know of for sure. That's called psychologytoday.com. Okay. And those have listings that various providers put up, and you can find somebody. A lot of times people think it's just cost too much. How much do you think is too much?
Right. One
person said they thought I charged like $1,000 a session. And I was like, oh, maybe I should, but no. Right? So it's like that mentality of just already putting limits on there without any research. Yeah. I would say, let's don't do that. Research and find the help you need.
Yeah. I mean, when you're talking about your mental health and your general well-being, don't put a price on it, I guess, is a takeaway from that.
Absolutely. I call it an investment.
Yeah.
Right? It's really, truly an investment, because if you can live a little lighter and live with a little more clarity, then that's a huge investment. It affects every aspect of your life.
Yep. Well, tell the good folks where they can find you.
You can find me on Facebook and on YouTube, and our website is www.clearlifecounseling.com, and the other handles are just at Clear Life Counseling.
Awesome. Well, we really appreciate you joining us. Hope to have you back one day. This was fun.
Absolutely. Thank you guys so much.
Absolutely. And if you're looking for us, you can find us at bettismusgrove.com, Facebook and Instagram, Bettis Musgrove. Until next time, stay safe, stay healthy. God bless.